In this video, I'm going to talk about something that millions of people worldwide deal with, Irritable Bowel Syndrome or IBS. If you feel like your colon is all over the place, or if you feel like certain things like foods or stress make your bowel symptoms worse, you need to watch this video. Whether you have IBS that's more constipation, or more diarrhea, or maybe even a mix of the two, this video is for you. I'm Dr. Alex Hill. I'm a board-certified women's and pelvic health physical therapist, and this topic is important to me, not just because so many people deal with it, but because I have it myself. So let's get your bowels less irritable. The primary symptoms of IBS are abdominal pain and altered bowel habits. The criteria for actually having a diagnosis of IBS is outlined in what's called the Rome 4 criteria. This criteria states that people who have IBS experience recurrent abdominal pain on average at least 1 day per week over the last 3 months, and that abdominal pain is associated with altered bowel movements, associated with changes in frequency of stool, like more or less frequent, and associated with a change in the appearance of the stool, so how it looks. The exact cause of IBS is unknown, but it's likely caused by multiple factors, including an abnormal communication between the brain and the gut. Potential causes for IBS are nervous system abnormalities, motility disorders, genetics, severe infection and immune responses, chronic or severe stress, visceral hypersensitivity, and changes in the gut microbes. If you do have IBS, the symptoms are most often triggered by certain foods or drinks and stress. For me, my IBS was triggered and started during a very stressful time about 8 years ago, and it took me a while to get a diagnosis, figure out what my triggers are, and how to best manage my symptoms. Diagnosing IBS can be difficult because the symptoms can change over time. Mine have changed over the last 8 years, and symptoms of IBS may mimic other disorders. Your medical provider will ask you a lot of questions about your symptoms, so it might be helpful to keep a log of your symptoms. That includes what you're eating, what you're drinking, what your bowel movements are like, how often you're going, and do you have pain. Tests that your medical provider may recommend are a colonoscopy, an X-ray or CT scan, blood test, a stool test, or even a breath test. All of these different tests are going to help them make sure that they have the right diagnosis and there's not something else going on. Once you're diagnosed, it's important to know what type of IBS that you have, and there are 3 primary types. There's IBS with predominant constipation, or IBS-C, predominant diarrhea, or IBS-D, or mixed bowel habits, which is IBS-M. So now let's talk about how you can actually manage your IBS. First, let's start with non-medication options. So first and foremost, and I can speak on this from experience, is to take care of your mental health. Stress, anxiety, and depression can all make IBS symptoms worse. Look into what self-care means for you and how you can help your mental health. Counseling has been thoroughly studied and found to be very beneficial to helping to cope with and manage stress as well as IBS symptoms. Practicing mindfulness, yoga, going for a walk, or even journaling are just some ideas to get you started on improving your mental health. Managing your stress can help with calming down those nerves and that communication between the brain and the gut, and also improve your symptoms. Next up is dietary considerations. So one of the most highly studied diets for IBS is the low FODMAP diet. FODMAP stands for fermentable oligo, monosaccharides, and polyols. Talk about a mouthful. That's why we use FODMAP. These are groups of carbohydrates that are known for triggering GI symptoms, and these include things like gas, bloating, and stomach pain. The more common FODMAP offenders for IBS are gluten, onion, and garlic. I know, all the good stuff. But reducing or eliminating these foods can significantly improve symptoms. Now, not all high FODMAP foods can be a trigger for you. So for example, even though I love hummus, I can't have a lot of chickpeas or hummus because this is a trigger for me and it can cause a lot of pain, bloating, and distension in my abdomen. So work with a dietitian, a gastroenterologist, or a physical therapist to help figure out and navigate a low FODMAP diet. I like to reference and use the Monash app for checking the FODMAP levels in different foods. So next up are probiotics. These are the good bacteria that are needed to help your body function. Probiotics have been shown to have a really beneficial effect on global symptoms, abdominal pain, bloating, and gas if you have IBS. You can get more probiotics in your diet by taking probiotic pills like Align. This is a well-researched and popular brand, and including probiotic-rich foods like kefir, kombucha, and fermented vegetables like sauerkraut, kimchi, and pickles. Instead of using only probiotic pills, try to incorporate probiotic-rich foods into your diet and then supplement with probiotic pills if needed. Let's talk about some other supplements. So peppermint and ginger can help with the pain, bowel changes, and nausea that you might experience with your IBS. You can get peppermint and ginger in your diet with different teas, pills, or use them in your cooking. I love the Allegra Happy Tummy Tea and the Ginger People Gingins for getting some ginger. The peppermint supplement called IB Guard can also be helpful, but the peppermint oil concentration is really, really strong. So make sure that you're monitoring that because it can cause heartburn. And before you start using any type of supplement or probiotic, always check with your medical provider first. I do have my favorite teas, ginger, and the IB Guard all found in my Amazon storefront, and those are linked in the description below. All right, next up is stay active. So consistent physical activity is a great way to help manage your IBS symptoms, especially constipation, as well as helping to boost your mood and your mental health. You may find that you need to do a more gentle and relaxing exercise like walking or yoga instead of a high intensity workout on the days that you're having a flare-up with more symptoms. All right, and then let's talk about pelvic health, physical and occupational therapy. So physical and occupational therapists who are specially trained in pelvic health can assess your bowel habits, your symptoms, your diet and lifestyle, as well as evaluate your pelvic floor muscles, abdomen, and your posture. Interventions may include adjusting your diet, retraining your pelvic floor muscles, and providing strategies to help improve your ability to actually poop or control any bowel urgency if that's the concern that you have. To learn more about pelvic health physical therapy and what to expect in your first visit, I promise it's not as bad as you're thinking. I do have links in the description below for a video that I discuss all about what to expect at your first visit. Now, not everyone is going to be able to manage their symptoms without medication, so let's talk briefly about some of the options that you have. Basically, medications are chosen based on what your predominant symptoms of IBS are. So if you have diarrhea, then antidiarrheals can be prescribed. If you have constipation, then laxatives can be prescribed. There are also medications that can help improve the actual motility of the colon, as well as medications that can help relieve the spasms and pain that you might have called antispasmodics. And then finally, the other common type of medication that can be prescribed are certain types of antidepressants to basically modulate the pain by acting on the nervous systems. These are often given at a lower dose than what's considered therapeutic for mental health conditions. Always talk to your medical provider to see if medications are appropriate for you and if they might be helpful for you. Like I mentioned at the beginning of this video, I do have IBS myself. I manage my IBS by avoiding and limiting my specific food and drink triggers, eating ginger or drinking tea with ginger and peppermint in it when I do have nausea or some symptoms, eating probiotic-rich foods daily, and managing my mental health. And I do that with counseling, exercise, setting boundaries, and journaling. But the best way to manage IBS is to learn what your triggers are and be consistent with what works for you. So if you like this video, please like it and make sure to subscribe for more videos on how to have the best health and pelvic health.